Hi, hello. Midside channel welcomes you all. Let's go into the video. Today we are going to see about diabetes mellitus. Before looking into the diabetes mellitus, let us see about the digestion of food. The food we eat is first chewed in our mouth with the teeth and mixes with the saliva. Then the food travels through esophagus from throat. From esophagus, it enters the stomach slowly. There, the hydrochloric acid produced by the stomach break the food into tiny pieces. From stomach, food enters the small intestine. These tiny pieces of food, along with the enzymes produced by the liver and pancreas, release glucose. The glucose enters the bloodstream through villi in the small intestine. When there is a rise in the glucose level in the blood, the beta cells in the pancreas immediately release the insulin to maintain the glucose level in the blood. Actually, insulin acts like a key. It unlocks the muscle, fat, and the liver cells so that glucose can get inside them and reduces the blood glucose level. You can see that in this picture. If insulin is not produced, then it leads to diabetes. What is diabetes mellitus? Diabetes mellitus is a chronic metabolic disorder. In other words, the increased glucose level in the blood is diabetes. Reason for diabetes mellitus: either due to insufficient insulin or deficient insulin or failure of insulin secretion, an increased glucose level is seen in the blood, which leads to diabetes. Types of diabetes mellitus. There are two main types of diabetes. Type 1 insulin dependent diabetes mellitus. Type 2 non-insulin dependent diabetes mellitus. Type 1 insulin dependent diabetes mellitus is caused by the destruction of beta cells of the pancreas. Hence, the inadequate insulin secretion abnormally elevates the blood glucose level. Hyperglycemia. The picture clearly shows that the lack of insulin shuts the door for the glucose into the cell, thereby increasing the blood glucose level. Reason for type 1 diabetes: genetic inheritance and environmental factors, infection due to virus, acute stress are the cause for this condition. This condition also occurs in children for young adults. Type 2 non-insulin dependent diabetes mellitus. In this type, insulin production by the pancreas is normal, but its action is impaired. The target cells do not respond to insulin. It does not allow the movement of glucose to cells. Reason for the type 2 diabetes. The factors are multifactorial. It includes increasing age, obesity, sedentary lifestyle, overeating, and physically inactive. Symptoms for diabetes mellitus: hyperglycemia, increased blood glucose level; polyuria, increased urine output; polyphagia, excess hunger; glycosuria, excess glucose secreted in urine; polydipsia, excess thirst; loss of weight, and fatigue. Prevention from diabetes can be by doing exercise, nutritious food, and medication, help in controlling diabetes. I hope you would have understood about diabetes mellitus. Thank you.